Good day, we are the Group 4A of BSM3F. I'm Cherubim Peñalosa,
I'm Marian Monteclaro.
I'm Irish National.
And I am Alyxer A, Peñaflor.
and we'll be discussing a research study on the self-assessment of perceived transcultural competence among nursing students. To begin, transcultural competence in nursing involves providing respectful care that's aligned with patients' cultural beliefs and values. Given the immigration of Filipino nurses and the growing demand for globally competent nurses, transcultural competence is vital for nursing students. The study investigated the outcomes of nursing students' self-evaluation throughout the subcategories of transcultural competence, which are cultural awareness, knowledge, and skills.
It aimed to determine the self-assessment of transcultural competence among the Level 4 students of the College of Nursing of a university in Bacolod City. Specifically, it aimed to answer the following questions. First, what is the demographic profile of the nursing students when grouped according to age, sex, and residence? Second, what is the level of perceived transcultural competence among nursing students as a whole and in terms of cultural awareness, knowledge, and skills? Third, is there a significant difference between the level of perceived transcultural competence among nursing students as a whole when grouped according to age, sex, and residence? And lastly, is there a significant relationship between the level of perceived transcultural competence among nursing students as a whole when grouped according to age?
The study followed a descriptive quantitative correlational research designed to analyze the nursing students' self-assessment of transcultural competence. It involved the collection of descriptive data and the application of statistics in aggregation to such data. Thus, comparing the relationships between the variables, it conducted an in-depth analysis that provided a reliable database that is specific to topics that have minimal pre-existing studies.
The participants of the study were specifically chosen with the following inclusion criteria. First, they must be enrolled in the BSN program for the first and second semesters of AY 2023 and 2024, and second, are in their final year of completing their BSN program during the AY 2023 and 2024. The total population of the level 4 students is 266. The participants included a total 154 students from the intended 160 across 7 sections of the level 4 nursing students.
The study was conducted through a modified cultural competence self-assessment checklist questionnaire that included items from tools used in previous studies. It consisted of two parts, namely the demographic profile and the modified transcultural competence scale, which is a 5-point Likert scale that measured levels of agreement in terms of cultural awareness, knowledge, and skills. Before the study, the instrument was pre-tested with 30 students from the level 4 nursing students, yielding a reliable score of 0.791.
For the results, in addressing the first objective, for the demographic profile of the participants, a majority of the participants were female between the ages of 20 and 22 years old and residing in Bacolod City. In addressing the second objective, for the participants' level of perceived transcultural competence, they presented an overall high level scoring highest in cultural awareness, followed by knowledge, then skills.
In addressing the third objective, there were no differences in the level of perceived transcultural competence among the nursing students when grouped according to age, likely due to the homogeneity of the participants in terms of age. However, a significant difference was observed when the participants were grouped according to sex. Specifically, the female participants presented higher levels of perceived transcultural awareness and skills compared to the males, possibly due to societal associations and roles regarding empathy and caring with femininity.
In addressing the fourth objective, there was no significant relationship in the level of perceived transcultural competence when grouped according to age, likely due to the homogeneity of the participants in terms of age. However, a significant relationship was observed when the participants were grouped according to sex.
Specifically, the female participants presented moderate to very high levels of cultural awareness as compared to the male participants. This may be attributed to the tendency of females to have higher emotional intelligence compared to males, which enables them to engage more effectively with individuals from different cultural backgrounds, leading to greater cultural awareness.
In conclusion, participants reported high levels of transcultural competence, indicating perceived high levels of their ability to recognize their own cultural biases and values, as well as those of others, their knowledge of different cultures, values, beliefs, customs, and communication styles as a contributing factor to the level of health care an individual receives, and their ability to navigate and engage with different cultures effectively, specifically involving the ability to understand and respect cultural norms, communicate across cultural boundaries, and adapt appropriately to various transcultural contexts. There were no significant differences or relationships when grouped according to age, but such were present when grouped according to sex. These findings contribute to the discourse on transcultural competence and underscore the need for improved approaches in nursing education and practice.
As a result of this study, the following recommendations are suggested. It is recommended for educators to prioritize students' attitudes, particularly in communication, empathy, adaptability, and conflict resolution of transcultural competence among students. The promotion of positive attitudes and empathy, cultural awareness, and appreciation for diversity can encourage open-mindedness and curiosity about different cultures and perspective for the students.
Ongoing professional development programs should be established to continually update nurses' knowledge and skills in providing culturally competent care and foster a supportive learning environment that encourages open dialogue and reflection on cultural biases to enhance cultural understanding among nurses.
In addressing the gap in the levels of perceived cultural awareness and cultural skills between males and females, the incorporation of comprehensive cultural competency training in the nursing curriculum is suggested, tailoring interactive workshops, case studies, and other activities to further the engagement of male self-reflection and the examination of their own cultural biases, assumptions, and stereotypes is vital in addressing this identified gap.
On the part of nursing students, engaging in activities that expose oneself to new experiences and diverse cultures widens perception, which translates to the improvement of one's transcultural abilities. Enhancing the existing cultural competency training in the nursing curriculum ensures that students receive comprehensive education on diverse cultural perspective practices.
Future research should further explore these variances. The significance of transcultural competence in healthcare outcomes is highlighted by students advocating for cultural competence training, exposure to diverse patient populations, and continuous education for healthcare professionals.
This concludes our presentation. Once again, we are the Group 4A of BSM3F, presenting our study on the self-assessment of perceived transcultural competence among nursing students. Thank you.